Dr. Tu, you said you worked on Dole's campaign and you voted for George Bush the first time, George Bush Jr. the first time. But today you're up here standing with Harry Reid, Dick Durbin, Patty Murray, and Chuck Schumer, insisting on healthcare reform. Want to talk a little bit about it? Do you see a contradiction there at all?
Not at all. I think that access to health care is a universal right, something embodied by the original signers of the Declaration. There really should be no disagreement about that among people anywhere in the world. Certainly it's consistent with the principles that most of us have seen in the 17th century with regard to personal autonomy, justice, beneficence. It certainly dates back to the days of the Greeks when they were first developing health care. I would imagine all of my colleagues I grew up with in the South would probably echo the same thing. The mechanism we get there may differ.
As a natural conservative, why do you think there's been so much pushback against having serious healthcare reform?
I'm sure that some of it is probably structural and probably gets us a little away from the key issues, which really just come down to the patient-physician relationship. The infrastructure of how we do healthcare in the United States is a complex issue, and there are certainly a lot of constituents that have a status quo that's important to them to defend and for very legitimate reasons. But at the end of the day, I think that we all agree that the actual chasm's not that big and that we are quite willing to negotiate to make sure that actually these simple things about allowing patients to be able to get access to meaningful health care hopefully can be achieved in a timely fashion.
If you were to run for office today, would you run under the Republican line or the Democratic line?
I don't think it'd be relevant to do either, but certainly as a pragmatist, I do whatever was necessary to make sure I had the appropriate support of the people who allow you to become a professional politician in this day and age. It'd be naive to do otherwise.
Well, you're a natural talent. Thanks very much, Dr. Tu.
Good luck.